I'll hold it like that. Hold it.
Just don't hold it like that. Just hold it just like that.
Hello, my name is Marcella Jones, and I'm doing this examination for Nursing 251. It is a recorded examination with my husband, Raquel Jones, who is my patient, and I am a registered nurse, and I'll be going over some health assessment techniques. So the first thing I'm going to do for this assessment is I'm going to locate the point of maximal impulse, which is actually on the midclavicular line at the fifth intercostal space. Now I can palpate here and feel the point of maximal impulse with one finger because my husband does have a chronic condition of tachycardia. So I can actually feel that because the anterior chest wall is thin in relationship with the muscles between his actual skeletal frame and his heart. I'll also go ahead and auscultate that area. I have my stethoscope. My patient is very helpful in pulling up his shirt. And I'm able to auscultate the heart, and I'm able to hear S1, S2, and an S3. An S3 is common in patients who may be athletic on the athletic side, and it is also sometimes a normal finding in children. Now we're going to palpate the carotid artery, and we're also going to auscultate the carotid artery first. Now the carotid artery is found in the upper area of the neck, and we palpate slowly. We're going to palpate against to feel the pulse. Now you never palpate both carotid arteries at a time because you do not want to cut off oxygenation to the brain. I'm going to auscultate over the carotid artery. And what I'm ultimately looking for is a whooshing sound that will be consistent with a Bruin. And that's a soft whooshing sound, but that is absent in my patient. I'm going to check the axilla to see if there's any enlarged lip nodes, and if you feel any pain, please let me know. And I ask you just to raise your arm a little bit. And if by me pressing, I'd like you to tell me if you feel any pain. And there's nothing felt in the axilla. I'm going to check on the other side. I'll ask you also to raise your arm. And I'll palpate as well to see if I can feel any enlarged or swollen lip nodes in the axilla region, and I do not. Now while I have my patient in the sitting position, I'm going to check to see if there's some resistance. Now in our last video, my husband's wrist wasn't broken, but in today's video, it is. So we'll start on this side here. What I'm going to do is I'm going to ask you to flex your arm up and flex your arm down, and then tell me whether or not you are going up or down. Don't look. Keep your eyes closed.
Down, up, down, up, down, down, up, down.
Thank you. I'm going to do it with the other arm, but I'm not going to do anything with the wrist. We're just going to go up and down with your elbow. Now I'm going to softly touch you, and you tell me if you're able to feel that and what area of the body that I'm touching. Okay. I'm going to ask you with your eyes closed to stand up. And now to spread your arms out, equally out, and to stand while we observe you. We're observing the patient now for about 30 seconds to a minute. The patient there's no asymmetrical falling of the extremities or loss of balance, and that lets us know that we have a negative Romberg sign. So the patient should be in good neurological function. Now I'm going to ask you to push against my arm as I push against yours. I'm testing for strength and resistance. Push. We'll skip your other arm. do it with your legs. When I push, you resist me. Do it on this side. And I find that the patient's lower extremities are equal in strength and resistance, and obviously at this point we can't test it on our upper extremities, but in the in the left arm, he has appropriate strength and resistance for his age. I'm also going to ask you to stand up again, and I want you to walk in a straight line as if you were stopped on the side of the road and you were doing a drunk driving test. And you want to walk in a straight line while I observe. I observe that the patient has a steady gait. The patient is able to walk clearly in a straight line with no loss of balance. We're going to ask you to sit down. Now what I'm going to do is I'm going to palpate for pulses in his lower extremities. We'll first start with, let me see your foot. I'm going to show for our camera here the posterior tibial pulse. I'm not able to palpate this pulse in a patient, which is making me think I have it on the wrong side, but on both sides I'm unable to palpate posterior tibial pulse. We're going to move up for our video, and I'm going to palpate for the popliteal pulse, which is behind the knee. And I'm able to successfully locate the popliteal pulse behind the knee in a patient's right lower extremity. Now, this is what we would find as an abnormal finding, not being able to palpate the posterior tibial pulse. That's an abnormal finding, and that could be a problem and be indicative of a perfusion problem in the lower extremities. Now, with the hands on, I'm just going to show where we would palpate the femoral artery, and that would be here. And being that the patient is on the thinner side, it's pretty easy to palpate because he does have strong bounding pulses. But you do not have one in your right lower tibial area, which may need to be found by a Doppler. I'm able to palpate the posterior tibial pulse and the left. And we'll do that again. And I'm able to palpate the popliteal pulse. And I can do the same with the femoral artery on the left side. Now what I'm going to ask my patient to do is to lie down while I inspect and auscultate the abdomen. You can lie down on a couch. And I'd love my trusty cameraman to come over here so he can record. Sit on the chair, Isaiah. Are you able to see it? Great. I now have the patient lying flat. I'm going to let the patient know that I'm going to be pulling up his shirt for the demonstration of the video so we can inspect the abdomen. What you see now is inspection of the abdomen, and we always inspect first because you don't want to palpate the abdomen if there's a problem. We wouldn't palpate if there were any masses or areas that look to be edematous or swollen. But first what we're going to do is inspect all quadrants of the abdomen. and I find that it's symmetrical and non-distended in nature. Now what I'm going to do is I'm going to auscultate. I'm auscultating before I percuss or palpate because I don't want to distort any vowel sounds. And I'm palpating in the right lower quadrant. And I'm moving over in the direction of how the colon and the large and small intestines flow within the body. And I'm able to hear positive vowel sounds in all four quadrants, and those are normal and appropriate. Now what I'm going to do is I'm going to lightly palpate over the area, and I'm checking to see if there's anything that's superficial there, any area that produces pain, that the patient may react as tender, or that the patient may guard. So I'm slowly in a circular motion going to palpate over the abdomen, and if you have any pain, please tell me that you have pain. And you didn't feel any. I'm going to do a deep palpation. And I'm palpating right here because I'm actually looking to feel the liver. And we can feel that the liver is intact here. And we're going to go over and palpate more deeply. And we're able to feel the spleen. Now what I'm going to do is I'm going to percuss over the abdomen, and we're looking for the appropriate sounds to be heard in areas where there should be air, in areas that should sound dull, so in areas that may indicate there's a problem. Percussion is a very important technique. In third world countries, doctors actually spend many years perfecting that because they don't have the access to technology that we have to detect masses or growths within patients. So with two fingers, I'm going to lightly press over the areas that I want to palpate. And in some areas, what we hear is dull. And in other areas, it sounds more hollow, which is appropriate for the masses that we're going over. Now I'm going to pull the patient's shirt down. All sounds were appropriate over the areas that they should have been. And that's going to conclude our recorded examination for Nursing 251. Thank you.